Hi everyone, day 50, whatever the heck it's up to, don't know. It was 2 weeks ago today that I had my surgery. Couple small little setbacks today. Busy day of appointments. I had an appointment with a nutritionist when I first got up this morning. Got up an hour earlier than I was supposed to because I messed up with my time. Nutritionist has nothing to do with the cancer at all, but I am having some distension in my stomach still, and she's having me try eating meals without drinking any fluids to figure out if it's meals or if it's fluids that are causing the problem. Whatever, I don't know. It could be unrelated to both, who the heck knows. But after I finished that, I had breakfast, and then I went outside on my back deck like I do all the time and went to go meditate on my cushion like I do all the time, on my nice little blue calming blanket like I do all the time. And it was sunnier today out, but I still had my PJ bottoms on. So got in the zone, whatever. I noticed, like when I'm on the bolster, I sit with my legs crossed, but they're not like on top of each other. One's just, they're not like this on top of each other. One's like kind of in front of the other. So it's not like I'm putting pressure on either one of my legs. And I felt the sun on my leg, and it wasn't really a big deal at all. Came inside, and I'm like, I want today to be as normal as possible. The nurse was coming today. I knew the physical therapist was coming today. So I go in my room, and I slept with my compression socks on all last night because I did have some swelling in my foot and my ankle yesterday. So, so I came back in my room and I went to go brush my teeth and get changed. And I sat in my bed to change my pants, and I noticed that the top of my right thigh, or not the top of my right thigh, from my right knee up to my panty line area, had this really weird, it's really hard to explain. It looked like I had dark red, not dark red, like someone had taken a Kool-Aid marker on my arteries and just kind of drawn on them. It would have been like a sunburn, but it was in the pattern of veins or arteries, not just blotchy. Hard to explain, and I still don't know what the heck it was, but I pulled my pant leg down to change into shorts, and I'm like, ugh, what the hell is that? For me, it felt warm to the touch, but when Barb felt it, she didn't feel like that it was warm. My left leg was fine. I took my compression sock off, and my right foot was a little bit swollen. My left was normal. My calf was fine. So I took a picture of it because I freaked out of it, and I put it up on the gateway and sent it to, I'm like, who's in charge of me now? I don't know. So I sent it to the breast surgeon. I sent it to my plastic surgeon, and I knew the nurse was coming, and she was going to be there in probably an hour after I had noticed. So I figured she could take a look at it too. By the time she got there, it was gone. The breast surgeon didn't know what it was. Plastic surgeon actually called me himself on the phone, and the only thing he thought it could be was deep vein thrombosis, but that would leave your leg blue and veiny, and this was distinctly red. It's very weird. I'm obviously still here. He said just keep an eye on things, and whatever he said, if it was showing signs of deep vein thrombosis, get myself to an ER, but it never did. And it went away within an hour. Like I said, by the time the nurse came, it was gone, but I told her about it. Checked my vitals, everything was fine. She looked at my swelling in my right foot, and it wasn't that bad at all when she saw it. And everything, I guess, was fine when she came. My vitals were fine and everything, but it weirded me out because that's the first thing that's been, like, awry since this whole thing started. And, like, it's super late and I should be sleeping. And, I don't know. It threw me for a loop that something, like, went wrong and that no one knows what it was from. It won't keep me from meditating, but it was just weird. So the nurse was here for a bit. She actually discharged me today from the home visits, whatever, which is good news. But then again, as things are healing and going well and people are discharging me, I'm like, well, what if something happens? And, it's a pretty big surgery to have. And it's like, I don't want them to all go away because it's like something goes wrong. What do I do? Like, whose list am I still going to be on? Whatever. So she took her hands around my face and she's like, stop overthinking. You'll be fine. Which I know she's right because I overthink. Anyway, so I asked her about the questions that I didn't have a chance to ask the plastic surgeon about. One of them was about my bra. I said, now that I don't have the drains anymore, do I still have to wear this funky bra? Like, I don't have the hooks on it anymore, but it does bother me on the side with the Velcro and stuff. And I'm like, I'm not going to go back to my underwires anymore. But I don't even know what bra size I am anymore. I don't know what cup size I am. Like, my back hasn't changed, but I don't know what cup size I am. And I don't have bras. And I don't want to go braless. I did that yesterday, and I talked about how that went. So I wasn't sure what to do. So I asked her, and she said, I could use sports bras. I could use, like form-fitting camisoles that have a little bit of support there. Like, I should still have support. I shouldn't be going, like, with nothing at all. Even though the plastic surgeon cleared me that, or not cleared me, but told me that I can go to sleep without wearing a bra tonight, which I was going to do until a little snafu earlier, which is partly also why I'm up late. Anyway, so I told her the drains were removed 2 days ago, and she wanted to take a look at the spots where the plastic surgeon just put the gauze on it, where the things were. And I said, I don't know how long to keep the gauze on, how long to keep the bandaging on. And it had only been 2 days. But she's like, it's like any other cut. You check the gauze. If there's no blood on it, then you're fine. So she checked the left side first, and the left side output drain-wise was like next to nothing. So I assumed that side would be fine. And she opened it up and she said, the gauze is dry. She's like, maybe there was a drop of like dried blood on it when it first, when he first put the gauze on it, but that was it. So she's like, I can take it off. And I'm like, off? It's only been 2 days, But because I'm being discharged, like, if she didn't take it off, I'd rather her do it than me or Barb do it because she's the professional. So she took it off, and the tape that went along with it, it's like a Band-Aid, I was a little leery, but I knew I was in good hands. And she pulled the tape off, and towards the top, again near my armpit, it hurt while she was taking the tape off, which makes sense because it's like a Band-Aid on a very sensitive part to your skin. And it was sensitive, but whatever. And she, I even touched the gauze because I didn't believe her. Everything was dry. There was literally like one drop of dried blood there that was probably from Wednesday, and that was it. And then she did the right side. And the right side didn't bother me as much. It didn't seem as irritated. but the right side is the side that I had more output on, so I was a little bit more leery with her removing the gauze, just because I'm like, there was a hole in my body where the tube was in. And I didn't post this because I did this last night before I went to bed, but I did end up cutting apart the tubing and the grenade. I just sat in the bathroom for a bit yesterday with it, and just as a processing thing, I just, took my glasses off, looked like real close on there to see like what exactly the tubing is made of and how's everything connected and what's still left inside and what's that like. And maybe that's what grossed me out a bit tonight too, which is again why I'm up so late. But when I cut apart the pieces of the tubing that wasn't my right side, obviously there was still some blood on the inside, and I took out, like, I don't mind getting like gory stuff, whatever, but there was some stringy stuff in there, and I was like just touching it, like, just exploring what that was like. And I just needed to do that for me as part of, I don't know, healing, acceptance, ownership, whatever. And there was a glob of tissue on the inside of the bulb that was like, it was gross. I mean, it was interesting to see how the tubing was, and like how super small the stitching is and how intricately tied it is, and it's just kind of neat to see. But I can get now why, I've looked at a lot of bright red blood over the past couple of days, and even while it was sitting inside the tube, like I still kind of had that in my head. So anyway, she took the right side off. It didn't bother me as much. And I'm like, I don't know what to wear now. She's like, well, we could just put the same old black bra on. And I'm like, I don't want the same black bra on, but I don't have another bra to put on. And I'm like, wait a minute, I do. Because my friend who has, she's a breast cancer survivor, she had mailed me a bra. A very thin material, very soft, yet supportive. And I'm like, in my head, I'm like, I'm nowhere near the point of wearing this bra, so it's just been sitting on a chair with other clothes. But I remembered that, and I said to her, well, I got this bra from a friend of mine, and I'm not even sure what size it is. It's like a small, medium, large kind of thing. It's not like a, specific, like 38C or something. And she's like, why don't we try that? And I'm like, okay. Like, I wasn't quite ready for that. The nice thing about that bra is that I don't have to put it over my head. It's one piece, but it's stretchy enough that I can pull it from the bottom up. So that's what I did. Pull it from the bottom up. The nurse, I think intentionally didn't help me with it. Not to be mean. I think she just wanted me to have the practice of doing it on my own. And I did that. The only thing I needed help with was because the tag was still on it, so I needed her to like level out the shoulder thing. But I put the bra on, and it's a nude color. It's not an underwire. It doesn't look like it's a hospital piece of machinery. It looks feminine, yet practical. And I put it on, and I stood up, and my belly's still a little bit big. There's still obviously a lot of fluid that has to come out. But I wasn't looking at my stomach. I was looking at myself head on. And there are cups, like the kinds that you remove, like if you have a sports bra or something, those are in there too. So I put it on, and it's like with the cups, you don't see my, the stitches or the scars. It just looks like a regular bra. And you can see the outline of like what looked like perfect boobs. And I put it on and looked in the mirror, and I'm like, damn. I'm like, he did do a good job. They looked like curvy, lifted. It's hard to judge about size because they're fuller now than they were before. And they are starting to move, where they look more like boobs than just these two lumps of stuff that are on my chest. So I felt very feminine. I felt normal. And I just took some time to look at myself in the mirror. It was just really processing, especially after what happened with my leg, and I got all worried and stuff, and I'm like, it's all gonna be okay. She told me I'll be fine. And here I am looking in the mirror like, wow, I look normal. So I wore that bra for the rest of the day. I put, regular shirt on over it, and it's nude, so it's not like there's some pink or black popping out. Notice I'm wearing the black bra again, so I'm going to get to that. And it's supportive enough. It's not like super tight, like Spanx kind of stuff, but supportive enough that you can move around. And I just felt good wearing it. I felt normal wearing it. I felt like I was a woman again wearing it. And I couldn't get out. I kept hearing in my head, what's that song? You make me feel like a natural woman. That's what I had in my head the whole time, because I felt like I was natural and normal. And then the physical therapist came. That was like an 1.5-hour appointment. That went really well. I have exercises I need to do. I'm not going to show them to you right now because I'm tired and it's late. But they're small exercises. Her goal is to get my hands up, at 90 degrees from my body. And I'm kind of at 80% right now without feeling strain. And she just gave me, like, I think 2 simple exercises, and one of which was just putting my hand in front of me up to the wall and just like crawling up with my hand to where it's like not uncomfortable, but to where I can feel it, and then just like not even holding it that long, and then just like bringing it right back down again, and doing that in the front, and then doing that from the side too. I have much better movement in the front than I have to the side. So I have those to do. And it was a really good appointment with the plastics or the physical therapist. She's going to come once or twice a week, she said. Have certain goals. One thing she said, which I liked, when I told her that I hear conflicting things about the level of activity I should have. And I said to her, well, who do I listen to? Do I listen to the person that's saying, take care of yourself? Or listen to the person who's like, here's where you should be? And she's like, you need to listen to you. And I'm like, but I'm not the expert. I don't know what the right thing to do is. And she's like, no, you have to listen to your body. How many times have I said that in the past week? She's like, your body will tell you if it's too much. You just have to stop and listen to it. She's like, you'll be doing something, and then you'll either be huffing and puffing, or you'll feel more of a pull on things. And if you feel that, she's like, stop. That's your body telling you what you can and can't handle, which seems so simple, but I'm used to pushing myself a lot, and I just have to stop doing that. So there were other things, I'm just not remembering them all, but she's coming once or twice a week, so that will be helpful. Excuse me. So she was done, and then I rested for a bit because I was tired. I tried to watch some show. I fell asleep 4 times, and it was like a 20-minute show. And then someone brought dinner by. It was mac and cheese. It tasted so good, and I'm like, I shouldn't be having this much salt, because that's not helping with my foot, and the swelling. My stomach actually was better today with the alternating food and then liquid. I just find that kind of weird to go through a meal and not drink more than like a sip or 2. And then after dinner, I wanted to watch a movie. It's the last weekend while Barb's here. My son is now at his dad's. So like it was I should say quiet night because we watched a horror movie, but still, and I like horror movies, so like it's not like I get freaked out by them or anything. But at the end, I was getting ready to go to bed, and I didn't want to sleep with the bra on. It was rolling up after a while, and originally I wanted to sleep with just no bra on, like he said, and I was looking forward to that. but I asked for help with getting the bra back down, because at the end of the day, I just get tired. And as I was doing that, well, actually, before that happened, I went in the bathroom for something, whatever, and I think I pulled my shirt, just look again at myself, like, ooh, look how pretty I am. And when I did that, I saw that there was 2 spots by my breasts, and I'm like, shit, like, what is that from? And it was only my left side, and I remembered that the purple markings from surgery are still there. And I'm like, damn it, like, I just ruined my new bra. It's not ruined, I'm sure it washes off. But, you know, oh, my thing keeps moving. That like, I messed up my new bra with the purple markings or whatever. And then when I went back later on to get changed for bed, and I was pulling the bra down with Barb's help, I got to the area under my armpits, and it hurt really bad getting it off of my left side. And my skin, I guess, where the tape was just really abrased. My skin is sensitive anyway, and it just like reacts more to things than other people's skin, whatever. So, and it had some adhesive still stuck to it. So it was like my skin was stuck to the bra, and I had to unstick it to be able to pull it down. That was not the most comfortable thing, but I'm like, grin and bear it. I'm like, just, you know, just be gentle. And we pulled it down together, and that side was done. And then we go to the right side, which is the side that was my fuller drain before he removed them. And similar thing where there was some adhesive, but not as much. And I did notice on the left side when it was pulled down that there was a stitch that's still in the middle. There was like, I didn't take a picture to look clearly, but there's 3 like red lines. I can look at it more in detail on another day. It's like it's too much today with the blood and 3 doctor's appointments that I had today. It was just a lot. I feel like there's a 4th one I'm not remembering, but whatever. It was just like nonstop from like first thing in the morning until like 3 in the after, or 3:30, I think is when the PT left. So I noticed the stitches were on the left side, and I assume that they're dissolvable. I wasn't expecting there to be stitches there. They must be the stitches that helps keep the tubing in. I don't even really know. But I hadn't seen that before because it was covered with gauze or bandages. And I'm like, okay, whatever. But then the right side we started pulling down, and it didn't hurt as much. And then I got it down, like the bra down over my legs, and took it off completely. And then I looked at my right armpit to see like if the stitches were there too, and I see a bubble of blood. It looks like a round bubble of blood that was by that middle. There's like 3 lines or whatever, and it was by that middle line. And I flipped because it was a round ball of blood. It was bright red, and I turned to Barb and I'm like, I'm bleeding. And that was the hole where the tube was in. So, not that it wasn't a big deal, because it was a big deal for me. I'm obviously still kind of, I'd be more wired about it if I wasn't so tired. But I saw that, and I was like, in my head picturing like, oh, my body's just not done with the blood coming out. And like, I'm just picturing like the flap coming up, and all the blood going like, psh, and like coming back out again. And just, you know, your head just starts going. And that little bubble just creeped me out. So we got gauze right away. I put pressure on it to make it stop. And I'm thinking I'm like bleeding profusely. I don't even know. But it was scary. Like, it was just a little ball of blood. You know, now that all that's done and it's quiet and the crickets are chirping outside, it's fine. it's just like, basically, if you, had ripped a Band-Aid off and, I don't know, it's not ready to be ripped off yet, I guess, whatever. And, oh, no. You know what happened? When we took the bra off, after, like, she put the gauze on and put some tape on and stuff, when I had put the other bra on, the non-black one, I could, and I took it back off. It must have, like, maybe when she took the original gauze off, something must have gotten disturbed, and it seemed like it was like maybe a very, very small little piece of, a little drop of blood that came out, but I didn't see it when the nurse was doing it because she was doing her thing and I didn't want to watch at that point. And then I think when I put the bra on, because it was like kind of, it compressed me, it was enough pressure to have the blood stop. But in the meantime, it had scabbed over. So when I took the bra off, it pulled the scab off. And that's what caused the bubble. But I didn't know that until after I saw it. And for me, it was just like there's a bright red bubble of blood coming out of my body. And I don't know. That just like threw everything for a loop for me. I don't know. I'm having a hard time with the words. I'm still having a hard time like wording. But it made me feel defeated, I guess. Like, I wanted to go to sleep not wearing a bra, and I'm like, I'm not going to do that now. That to me tells me that things aren't as ready to move forward as I thought they were. So we put gauze on both sides, taped them up, or I just sat there. Barb did all of it, and that was the first time where I said to her, make sure you have gloves on. Like, she puts gloves on, but I'm like, I've never had blood flowing out of me since she's been here, or since my surgery, really, except for the doctors, like when the tubes were removed. But I got nervous, like, please make sure that you put gloves on, because I have fresh blood flowing out of me. And it's a lot for a friend to see. There's so much to process with all this stuff. Like, one stupid little ball of blood can just totally throw you, and it seems like it's not a big deal, but after all the manipulation they did to me, and like, maybe because it was like the first time seeing like my insides, like something from my insides from this whole process. I can't quite put my finger on it. But obviously it's still sitting with me. So anyway, I didn't want to go to sleep with not having a bra on. So I put the black bra back on again, and I feel not happy that it's on. I feel like I took a step back, which I did. And it's not a huge step back at all. But I'm like, just cut me a friggin' break. There's been so many things, like, in life in general for me that have not gone as planned. And granted, this is something small, but, like, all this has happened to me since July 9th. It is now, September 3rd? It's been so fast. You go back to school and they're like, what'd you do over summer vacation? You know what I did for my entire summer vacation was I dealt with a breast cancer diagnosis. It started July 9th. Like, so, school was over. Summer was starting. It was right after July 4th. And I'm like, let's plan our summer. And then it became all about cancer. And now it brings us to September 1st when school starts. Like, what the hell? That's not what you're supposed to do over your summer vacation. And it's just poof, it's gone. It's the last summer vacation before my kid goes off to college. And it just sucks. Like, why can't things just be normal? Like, why can't I just get a damn break and just have things go smoothly like they're supposed to go for a change. Anyway, so I have the stupid black bra on. Gotta wash the other bra now. Hope I didn't ruin it. One of my friends, also a realtor, it's funny. Oh, I wonder if that's why. Because they were the woman who helped me with the bins and stuff. She's also a realtor, and I am pretty sure they're in the same realty company. Because a friend of mine reached out to me today through text that I haven't heard from him in a long time, and was checking in on things. And I mentioned something about the bras, whatever, and the nurse, I think, gave me some Amazon links for some bras that I could get. But I'm like, I don't want to research them. I don't want to do any research. I just want the bras that fit to be here. I don't want to have to like look through them. That's what stopped me last time when I, however long ago that was, when I was doing the, what to shop for vlog, and I got like all these nice shirts in my shopping cart, and then I got to the bras, and I'm like, I don't even know what bra size to pick, so I never bought any. Because how the hell are you supposed to know what size bra? Like, I didn't know they were going to have my final implants in. I thought they'd have expanders in. So I'm sitting in bed, and I went outside and was just breathing for a bit because it's nice outside and want to get some fresh air. But I feel weak today. I feel worried today. I have my compression socks back on. And honestly, I'm scared to go to sleep. I'm sure I'll be fine. But I'm scared to go to sleep because, I don't know what the hell happened to my leg this morning. My swelling keeps going down, but then I'm like, I ate mac and cheese for dinner, which is super salty, but it was so good. And I was like, I keep pulling up my leg and looking at my thigh, and it's fine. But it's like, what if something else happens? I'm happy that I'm not here on my own. But after Monday, I will be. I mean, Caleb will be home, but during the day, he's got school, and this is the tough part when it's when you're single and, you don't have family nearby, and I'm grateful that Barb hasn't run away screaming. All the stuff that she's seen and all the sides of me she's seen, and people tell me a lot. I don't know if I've ever mentioned this or not, but people tell me I have a resting bitch face, and I'm like, that's just what my face looks like when I don't smile. Sorry, I can't help it. That's what I look like. But they say that I'm intimidating. When people first meet me and they don't know me, they think that I'm intimidating. Especially when I'm dressed up and if I have heels on or something, they're afraid to approach me because I look intimidating. I'm like, but I'm really not. But okay, that's how I come across by my resting bitch face and heels. What am I going to do about it? Put a fake smile on my face. That won't look creepy at all. But today when I was melting down to her about a little stupid drop of blood, and she's reassuring me that even now she's checked the gauze 3 times, and she's like, Jen, there's nothing there. It's just white. It's fine. And I'm sure it's fine. I'm sure it was just 1 drop of blood. But then it turns me into this marshmallow. And then my son came home, and his birthday is this weekend, and I won't be there to I love birthdays. I won't be there to scare him in the morning with 100 balloons by his door. Not literally 100, but I would usually blow up 17 balloons by his door and throw them at him in the morning. And it's his last birthday here before he goes off to school, to college. But he's at his dad's this weekend, so I won't see him until Tuesday. And, I'll miss him. he's he's not that far away, but like there's a lot of endings. You know, I'm hitting the point in life where he's my youngest kid and he's going off to college, so I'll be an empty nester, and like, what's that going to be like? There's just a lot of changes, and you know, change requires adjustment and healing and acceptance in all sorts of ways. When it comes to cancer, sure. When it comes to your kids going off to school, sure. There's just a lot today, and I'm just dilly-dallying because I don't want to go to bed. And I'm like probably a week behind at this point with posting my vlogs on YouTube. But I've just been so tired. Like I filmed them. Half the time my thoughts were so scattered. But it's just where I am. You know, I did spend some time YouTubing other people's vlogs. And what I find so interesting is like I want to find someone who's like my age and, you know, someone who fits the same characteristics as me and seeing their journey. But there's so many moving pieces to breast cancer, even though it's so unfortunately common. There's so many different moving pieces that it's like virtually impossible to find someone. You'd have to like do the math to figure out the permutations of all the factors between age and like who's single and who's married, who's had kids, who hasn't, you know, who had chemo first, who had radiation, who found a lump, who did not find a lump, who looked in the mirror and their partner said, oh, one boob looks different than the other, and that's how they knew. For me, like, there were no signs for me to know. I have a full-length mirror in my room. It is probably 6 feet tall, and I pass it all the time, like without a shirt on, and never would have noticed. Just thought I was getting older and my boobs were getting saggy. Never would have noticed. And that just happened July 9th. It was less than 2 months ago. And now I have my non-boobs. I have breast implants. Like, what the heck? I'm like so authentic and real, and I have breast implants. People's telling me like that my vlogging is like journaling, and I'm like, I guess it is. But I don't share everything, even though you might think that I do. There's plenty of things that I don't talk about. Mostly like about my family and stuff. And certainly not my kids. But it is like journaling, to just share what's going on for me. And you want to find people that, you know, share your story. And it's like, yes, welcome to the club of breast cancer survivors, because now I can call myself that. Gone through the surgery, you know, my body, nothing's showing up that there is any cancer, so that now puts me in the category of breast cancer survivor. I don't even know how I feel. I mean, I feel happy that I'm a survivor. I just don't know how I feel about the label. If this keeps moving, about the label behind all of it. I've had enough things in my life that could label me, and I don't like to label myself. But in the same way, when it comes to things like YouTube, and when you want to find someone who has the same story as you, you'd have to put in a whole heck of a lot of search items to find someone who has the same story as you, or even a similar one. And even with the receptors, like, you know, people are triple negative, and what that means is, you know, cancer cells are fueled either by estrogen or progesterone or the HER2 or HERS2. And for me, my cancer cells were positive for progesterone and estrogen. So I know that, like, that's what's feeding my cancer, which is why they took my Mirena out, was because that was giving my body progesterone. And why would I want to feed the cancer cells? Which is why the doctor, the breast surgeon, had said that when the surgery is done, I don't think I'll need radiation, but she didn't know that at the time. The lymph node situation was what would kind of determine whether I need radiation. But being on tamoxifen basically like kills off the receptors on the cancer cells for estrogen and progesterone. So that way it can't suck those things from your body, because you're killing off the things that, like, kind of the feelers that pull that from your body. And then you could be triple negative, which means your cancer cells are not showing up as being positive for any of those three things, and you don't know what's feeding them, which is, often when people have chemo first before they have a mastectomy, because they don't know what's feeding the cancer. I mean, I'm lucky in the way that they know that it's estrogen and progesterone, so they can, find ways to not have those things in my system. But yeah, I have to plug in a Google search that has, my age and like oncotypes. I don't even know what that is yet, because I haven't met with an oncologist yet. Are you triple negative? Are you positive for this receptor? Are you positive for that receptor? Have you had chemo? Do you need radiation? Are you having reconstruction? Are you not having reconstruction? Are you having a lumpectomy? Are you having the whole mastectomy? Are you having double mastectomy? There's just so many moving parts, and I can't type all those things into a search box. So while you might even know a lot of people that have had breast cancer, all the stories are different. They're all so different. I'm in a place right now, actually, as I change how I'm thinking, mostly because of the bra that I had on today, where I put it on and I'm like, now I get more so how, when it's all said and done and they've settled to where they're going to be, I don't really know if I want to have nipples or not. Originally I was like, I can't picture not having them. But it's kind of nice to wear a bra and not have to worry about whether it's cold outside or not. Or having them stick out or whatever, or putting pasties on. Like, I would never have to do that. And I could still have them tattooed on and have it look like a real one, or a real two, with tattoos. I absolutely, definitely want to get a tattoo on my sternum between my breasts. That is down the road. But that image, when I saw that on the screen at my breast surgeon appointment, which again is many vlogs ago at this point, that just made it look like a work of art. So yeah, every person has their own story, and while you're all together in the breast cancer club, it's all so different for everyone. You can give as much advice as you can, but the only person who knows your own story is you. And, I don't even know what the moral is today, because my mind is still just focused on that one ball of red blood. And my head says everything's going to be okay. But my heart and my emotions are still super processing this week. So I'm going to sign off, get some sleep, try not to think about my leg. Maybe I'll put on some guided meditation to help me sleep. It's just one small setback. It's just a bra. It's not a big deal. But when you've dealt with all this crap in such a short time hammered at you, a little drop of blood is a big deal. And whatever the hell that was on my leg, I don't even know what that was. Hopefully it's not a big deal. It's gone. I hope it doesn't come back. And I'll just make sure that when I prop myself in bed with all my 25 pillows, I'll just make sure that I put my legs how they're supposed to be and take care of me. And, have faith and pray that I'll be okay. and ask, you know, if you guys are religious too, pray for me too, that it was not a big deal and that it won't happen again and that it'll be fine. It can't all be sunshines and roses, and I get that, but, you know, I would just like to have a good year of sunshine and roses, and it will happen, just not right now, but it will happen. Here's my, I can't lift my arm up enough to give you my anyway, I'll see y'all tomorrow. Bye, everyone.